everyone who I didn't get to see or who, if you weren't with me last week. Last week we did some breathing exercises and some relaxation exercises, just focusing on sort of the head and neck. And today I thought we would do a body scan exercise together. And I don't know if you all are familiar with the body scan technique, and it's pretty simple, which is just about noticing different parts of the body, relaxing them, focusing on those different parts, and sort of moving up throughout the body to relax the whole body. And it seems really simple to me. And actually, one of my son's teachers last year started to do this with their elementary school group. But a lot of evidence has shown that it's really helpful with reducing stress, and that can help reduce inflammation, kind of sometimes lower blood pressure, but also just lower the stress in the body. When they've done studies of doing, say, weekly sessions of these body scans with people, they have shown that there are reduced cortisol levels and stress levels. And so I thought we would try it tonight with everyone, and you can practice this on your own at home once a week or maybe a few times a week. See what works for you. Sometimes I think there's certain people that like to be a lot more active and have sort of an active meditation process. This might not be for you, but if you can sort of play with it and see if you can just let go and do it, great. If not, then you might want to think about a more sort of active mindfulness process, like maybe a walk that's just where you're not doing anything else, talking to anybody else, doing anything on your phone, but taking a walk and just being in your body, experiencing your body as you're taking that walk, feeling your feet on the ground. That might be easier if you struggle with relaxing and just giving into the process with this kind of a mindfulness practice of the body scan. But for now, let's try it and see how it goes. And you can either start, sometimes I'm sitting up in my chair. If you like, you can lay down. So if you have a good, comfortable space to lay down, we didn't prepare everyone for this, but if you want to and you have a comfortable place where your body is going to be supported, so you don't want it to be kind of too soft or mushy. I like, maybe a yoga mat or comfortable mat on the floor, and maybe a gentle blanket or something, or a pillow that's not too high for under your neck to support your head. And if it's cold or cool, you can think about sort of a nice light blanket over your body, just to keep yourself warm and so you don't get too cold in that position. So if people want to and have that set up where they're able to do that right now, you're welcome to get into that position. And I'll give folks a moment to do that if they want to do that. And if you don't, if you don't have the opportunity to lay down right now, you could think about that as a possibility for the future, but you're more than welcome to just sit in your chair. And what you can do is just sit nice and comfortably in your chair, and evenly on your seat. So you want to be comfortable, but not slouched and noodly. You just want to be comfortable and sitting up nice and upright. You can allow for just a natural curve of the spine. So I don't want you to feel forced or like you're kind of really working hard to lift yourself up. And in that case, being on the floor is kind of nice because you can totally release there. But once you're in a comfortable position, I'm going to have you go ahead and just be where you are. And if you're sitting in a chair, make sure that your feet are both evenly flat on the floor, and that you're sitting evenly on both sides of your buttocks. So you're sitting comfortably, evenly in the chair. And your body is just upright and over your pelvis, and not straining in any way if possible. If you're lying on the ground, you can just let your legs sort of relax. And sometimes they just sort of turn out to the side, your feet turn out to the side naturally. That's okay. And then arms should be just relaxed and palms up by the side in a comfortable position. And again, head should be supported. Maybe I don't want to have your head back like this. So if you are lying on the ground, having a little bit of support underneath your neck, not so that your chin is up too high, but I don't want the back of the head to be sort of lower than the rest of your body. It should be nice and straight. And when you've settled in a comfortable position, I just want you to be where you are, and you can close your eyes to start. Sometimes that helps to go inward and to notice. Because when you open your eyes, there's oftentimes a lot of distractions, and closing your eyes can help you go inwards and focus on your breath and your body. And if you're sitting, you can either, have your hands down on your side, or maybe just have them resting gently, palms up on your lap. Sometimes that feels comfortable. And just go ahead and take a couple of normal breaths here. So you don't have to work on breathing. Just notice your breathing and observe your breathing as you breathe in and out. And you can observe, is the breath coming in through your nose and going out through your nose? Can you feel the air coming in, and the air, when it comes in through the nostrils, gets warmed by your nasal passages? And can you feel it going down into your lungs and filling your lungs? And then gently releasing it. You don't have to force it. Just feel the way it feels coming in and out. Maybe it feels more natural to let the air out of your mouth. That's okay. Just taking some nice breaths here to settle into your body in the space where you are right now. And we're basically going to start to just notice sensations in our body and be with those sensations. Let them come and observe them. And we're going to start by thinking about your feet. And you can notice the sensations in your feet. First, notice the position of your feet. If you're lying on the floor, how they're supported by the ground, what part of your feet are touching or making contact with the ground. Maybe they're making contact with each other. Do they feel cold or warm? Do you have socks on or shoes? And can you feel the sensation or the pressure of that feeling of socks, or if you do have shoes on, what that feels like on your feet? Can you let your feet relax completely and just let the muscles in your feet go? And just notice how they feel. And if your mind wanders away while you're just noticing, that's okay. If there's sounds or other things that are going on in the background, that's okay too. You can just notice it and observe, and then gently bring yourself and your mind back to your feet where we're focusing right now. And then we're going to travel up and feel, the ankles. Can they relax? Can you relax the muscles just around the ankles and then the lower leg? So your chin, your shins and the calves. Are your calves touching anything? Are they resting on something if you're lying down? And what does it feel to have that pressure of the calves and the muscles of your calves resting against something? Or if you're sitting up in a chair, can you feel just a release in the calves and letting those muscles go? And is there anything touching, like clothes, or if you have pants on, you just notice the feeling of that cloth on your skin? Again, do your calves feel or your shins feel warm? Maybe there's not much sensation at all there. Sometimes there's more sensation that you notice somewhere else, like in the feet, that isn't there in your lower legs, and that's okay. And then you can gently bring your attention up to your knees. And just think about, the area around your knees, especially if you're lying down, to make sure that area is relaxed completely, that you're not bringing any tension around your knees. Sitting up, I think they're usually pretty okay and relaxed. If you do notice discomfort, or if you're having discomfort, there's a couple of things you could do. So if you notice a sensation that arises, like maybe if it's a pain, or if it's some type of discomfort, or maybe it's something like itching or a tickle, you could do a few things. You could be with that sensation and breathe and just notice. And if you let the sensation be there, can you notice it? And do you, if you do something about it, you could move to do something about it. You could also just let it be where it is. Does it go away on its own if you just observe? Does it stay there? If you're really uncomfortable, of course, you're welcome to adjust or move a little bit. That's okay. So we're going to move up to the upper thighs. And if you can completely just relax and let go there. Notice any sensation that you feel. And again, if the mind wanders off, you can just notice that it's going somewhere else and gently bring it back to focus on your legs and your thighs. Are they resting on something? Is there pressure of your thighs against the ground? And are there certain points in your legs where there's more pressure versus not against either the ground or the chair? Just notice how that feels. Now you can move your attention up towards your lower back, your buttocks, your lower spine. And again, this might be an area where you feel like there may be some discomfort or some need for adjustments. Sometimes it helps if you do have a little lower back strain or discomfort, and you feel if you're doing this practice in a lying down position, it can help to put maybe a bolster or a pillow or some kind of roll of blankets underneath your knees to support them. And then also when you're lying down, you can sort of adjust by lifting up your buttocks and sort of tucking under a little bit and then lying back down. So you put your back in a little bit of traction there, and that can release some strain in the lower back. And then having your knees up on a bolster or pillow just a little bit underneath your knees can release that strain if there is a strain from lying down. So you really want to make sure you're taking care of yourself and noticing discomforts or things that come up and not fussing too much, but also being gentle with yourself and kind to yourself in this practice. And again, feel how your lower body, the lower spine, your buttocks are seated. If you're sitting in a chair, can you feel the sits bones or the seating bones, the buttocks bones, really sitting in that chair? And are they evenly spaced, and is the pressure evenly distributed? And then you can move your attention up the spine. And especially if you're sitting up, sometimes there's a lot of tension that can be held in the spine, in the upper spine. And can you release some of that tension gently and just mindfully thinking about the muscles that hold you up and hold up your upper back all day, and release them if you're able to release your shoulders down with that. And just breathing normally and noticing the sensations in your upper back. And again, if you're on the floor, there's an opportunity to sort of relax into the floor and totally let go of any tension and let go into the floor. And we're going to bring our attention to the belly and the abdomen. You notice sometimes there's more sort of feeling or emotion that's held. We'll get to the chest soon, but even in the abdomen, sometimes there's feelings of emotion that come up there, or maybe not. When you breathe in, do you feel your belly rising? And then letting go. Are there any other sensations you feel in your belly? And can you let your abdominal muscles totally relax? And then move your attention into your chest area and your sternum. And you can just let the breath come in and out. And notice how the breath moves your chest up and down. And if you can let yourself relax and not hold or tighten around the breath, and also just observe. Sometimes the breath also expands the rib cage out to the sides. You can feel that sensation as well. And then is there, there's sometimes a lot of emotion that's held in the heart and the chest and the abdomen in this area. And if you're feeling a lot of emotion, that's okay. I think it's good to be kind to yourself and notice that and observe that that's happening. Now turn your attention towards your hands. They might be lying by your side. They might be lying in your lap. And we do a lot with our hands all day. How are they feeling now? Are you able to just let them go and observe the contact points where they're touching and how that feels? Is there any discomfort? You can notice that. And if you need to readjust, you can do that, or you can also just observe. And then let your attention travel to your wrists and your upper arms. And is there any temperature changes that you notice as you travel to these different places in your body? Other sensations of the arms touching either the floor or maybe your lap or the chair. Can you let the muscles relax there and let go? And then slowly you can move to your upper arms and your shoulders. Notice how things feel, and there's often a lot of tension in the shoulders and then the shoulders connected to the neck there. Can you release that completely and release those shoulders away from the head? You don't have to kind of slump or make an effort, but just gently release and observe and notice how they feel. And then you can bring your attention to your head. Sometimes swallowing gently a few times can sort of help to release the tightness or feeling of tension in the face and in the mouth and the throat. And can you let some of that tension go? And there's a lot of sensations that we can feel in our head, obviously, but think about the sounds that you hear and that are around you. You can feel the air coming in your nose and mouth, and what it feels like to release that air when it goes out. Are there any other sensations, like maybe a sensation of taste or smell, things that are in your environment? Can you relax your eyes and your forehead? Sometimes it helps to also visualize sort of the center of your brain and visualize it dropping down sort of into your heart, into your chest, and just letting it go. Can you feel, if you're lying down, just the back of your head releasing into the ground and into the earth? And if you're sitting up, just that sensation of maybe just letting the muscles relax and release just into the rest of your body and your torso, and relax your neck and your shoulders. Just take a few normal, just regular breaths here. Just being where you are and open to the sensations that are happening right now. And when you're ready, you can start to deepen the breath just a little bit. Bring yourself sort of back to the room and to your whole body and where you are. And gently wiggle your toes and your fingers. And you can also gently open your eyes. if you're lying down, sometimes a nice way to come up is to roll to your right side and gently push yourself up with your arms and gently bring your head up. So slowly rolling up and bringing your head up last, and then coming to a seated position. And you can do a similar practice like this, once a week. Sometimes it's a nice practice to do when you have a moment, maybe between, say, a transition in your day or to the start of a day. If you feel like you want to then come back to sort of a place of maybe better clarity, less stress, it can be helpful, just like my 10-year-old does at the start of his day, sometimes in his elementary school class, to get themselves focused and ready and present for the day. And I hope you'll find it helpful.
I want to thank you, Annika, that was in guiding us in this gentle restorative practice. I always find it's almost difficult to come back in, even though you wake our bodies back up into joining, coming outside of our mindfulness back into the world. But I really thank you. You have been instrumental in our series, and we love having you with us. So thank you so much. I want to thank all of you that have joined us this evening and through this mindfulness series. And I hope that you have found, I'm grateful that you've added this to your self-care, because we find that very important. As I mentioned, we are going to continue our series beginning October 1st, once a week, to continue it because it's been so well received, and it's so important to come together in these times to really appreciate our self-care and take time for ourselves. So I hope you join us again. As I mentioned, you do not need to re-register. We will continue to communicate with you about the series. I continue to ask for your thoughts and opinions because we really want to make sure that we are addressing your needs, and what's most important now is what time is good for you. I would be remiss if I did not thank again our sponsors, Amgen and Novartis, because without their support, we could not continue to offer this. So please know you are important to us, and we're happy to have you with us. And please, all of you, be well, and we'll see you in October.
Thank you, everyone.
Okay, I'm just